Very pleasure here to see you all. The topic is of course diabetes. First of all, the most important thing is diabetes is not a disease. It is not classified as a disease. It simply means, yeah, you have to really switch off the mobile. It only means high sugar in your blood. That is what is it. So, for people like me, my weight is about 70 kg. So, about 5 liter blood is running in my body. And for every liter of blood, about 2 gram of sugar is there. How much is 2 grams of sugar? About little less than half a spoon of sugar. So this means about 1 spoon of sugar in the total bloodstream is going. That is what is the normal blood sugar. But those whom we call as diabetes patient, instead of 1 spoon, maybe 1.5 spoon of sugar is circulating in the blood. This means that excess half a spoon of sugar, if you can take it out of the blood, you are no more a diabetes patient. That is so interesting and so important. You have been taking medicine for last 1 decade or maybe 2 decades. It doesn't matter. What matters is that you must understand how much is excess and you must know how to take that excess out. How much time it takes to take the excess out? Roughly, it has been more than 10 years I am in this field and seen more than 20,000 patients. So it takes for most of them, for 90% of the diabetes patient. When I say diabetes patient, you remember I am talking of those patients, those who are inpatient actually. They've been diabetic for a long time and a lot of complication already happened. That is the kind of patient who comes to me. So I'm talking, for those kind of patients, it takes about 72 hours to take out that excess sugar out of the body. And once they are able to achieve it, then they are no more a diabetes patient, normal blood sugar. So that the reading comes normal. And that you can do it, and that you can do only without medicine. With medicine you can never achieve. First of all, we have to understand 2 important things. Why there should be a sugar in the blood. Right now, at this moment, you are able to listen to me, you are able to understand, most important, you are alive. So we are having collection of cells, millions of cells all over the body. And each of the cell, to live, it needs energy, continuous supply of energy. And blood as a transporter, it supplies the sugar as a primary source of energy. And the sugar is burned in the cell, converted into energy, and it is that energy which is keeping us alive. Sugar is good or bad? Because of sugar we are alive. Good or bad? It's good. High sugar is good or bad? High sugar means too much of energy, isn't it? Doctor says, oh, you have very high sugar, you're happy, this means I'm full of energy. How can it be bad? So, sugar when circulating in the bloodstream, too much of sugar circulating in the bloodstream is something like this hall. Each of the cell, you imagine like this hall, your city, Singapore is your body. So, some of the seats are still not full because we just got a call, people are still stuck in the traffic or something, delayed, and they are still arriving. Delayed. Most of the people on the street, they are not at the place, right? So cells in your body is waiting for the sugar, hungry, but sugar stuck in the transportation system, which you call the blood vessel circulatory system. So that is what is called diabetes. If excess sugar is there in the transportation system, this means there is a traffic jam. And that means each of the cells like this, they are hungry for more people. We are hungry, let the seat be full, right? People want to come, we want them to sit here, but there is a gap, the delay. Delay because there is too much of traffic. So when the sugar is too much in the blood, that means too much of traffic. And that itself slows down the circulatory system. And that is which organ of the body will affect the most? First of all the organ, because each and every cell needs sugar, right? So, which kind of disease one can have? All the disease, right? So, but which one will happen first? Heart disease or kidney failure or eye? It depends, now it depends on your genetics now, right? So if your ancestor died of heart disease, it is not destined that you are going to die of heart disease. But if at all, your sugar is stuck on the traffic, then when the body need to choose which is the first organ to get affected, then it depends on now what is your genetics, what is your ancestors' blueprint. So then it comes genetics. Genetics comes too late. So we not to worry about genetics. Only we need to worry that excess sugar which is stuck in the on the street, we have to just take it out, that excess sugar, and if we can do it, then the things will become normal. Will become normal. Right? That is very, very important. And we have to also see, once I have achieved it, once you have achieved it, you have to see that it should remain like this for rest of the life. That is, becomes your responsibility. Right? Like a emergency traffic management system, for a while they manage the traffic, but if they go away, again the same chaos may be there. So first, throwing out the excess sugar, and second, ensuring that excess sugar should not get accumulated again. So it is a lifelong commitment for you, for us. So there is no medicine for it, the most important thing. And the kind of medicine which you are taking and thinking that these are the diabetes medication, just think again, is it really a diabetes medicine, the kind of medicine which you are taking? So think of the first time when you were told you are a diabetes patient. The first reaction, you did not accept. How can I be a diabetes patient? I had never been a diabetes patient in my life. How suddenly I can be a diabetes patient? And that is true for everybody. Whoever is a diabetes patient, at one point of time he was not a diabetes patient. And suddenly one day, because of some reason, oh, you're a diabetes patient, glucometer reading, right? Then you look around and you see many people of your age, they had been already taking medicine for quite some time. And also people around you and the doctor, they convince you for a while, and after that, you accept as a diabetes patient, and you know that I have to take a small pill, and with that pill, blood sugar will come down normal, and I can go on in my life. And so you take a small pill, blood sugar came down to normal, but till few months. And after that, in spite of taking the medicine, your blood sugar shoots. Now, what are you going to do? You'll go back to the doctor. Doctor, I'm taking that medicine, in spite of that, my blood sugar, it went up. What do you think the doctor will do? He will increase the dose. With little increase of the dose, you come back and you start taking it, again blood sugar comes at a satisfactory level, but only for a few months. And after a few months, in spite of taking the higher dose of medicine, what happens? Your blood sugar shoots up again. Now what you are going to do? Of course, you'll go back to the doctor. What do you think what he is going to do? He is going to increase the medicine. Different kind of medicine, same medicine, more dose. And with a very, very high dose of medicine, you came back and now you are again, the life resumed, everything seems to be normal, blood sugar is normal, only for few months. And again your blood sugar came up. What do you do now? Of course, you'll go back to the doctor, same doctor or different doctor. What do you think the doctor will do now? He will increase the medicine, either it is a pill or insulin. So this will keep on happening till the time the patient either loses his life or loses all his money. Why we think that this is a diabetes medicine is controlling blood sugar? It is not controlling blood sugar. Had it been controlling blood sugar, so why you need to increase the dose after a few months? It is accumulating more medicine, accumulating more symptom, accumulating more disease. So the kind of medicine which you are taking currently are not a diabetes medication, right? So they temporarily, it looks like that they are controlling your blood sugar, but in real sense they are not contributing to your health. All those medicines which you are taking, most of the diabetes medicine, metformin, sulfonylureas, etc., these medicines, they came in the market at the time 1960, before 1960. That was the time when for any medicine to come on the market, they did not need a randomized control trial, RCT. Right? Just, it was a case study, okay, it was assumed that the sugar has come down, that means the patient is improving. There was no parameter other than this. So anything, any poison which can lower down your blood sugar can be approved as a medicine. That was happening till before 1960. So the kind of medicine which you are taking now, it did not come now, it was from the time when there was no RCT, randomized control trial, right? Randomized control trial means, let's say there are 200 people or 2000 people, and both are having high, all 200 people are having high blood sugar. So randomly, randomized control, randomly they pick up 100 people and giving them medicine, and rest of the 100 people let their blood sugar be up, and they are not put on medication. And now the scientists, they will follow these two groups for a few months or few years. That is called randomized control trial. Right? And then it becomes more clearer what happens after 1 year, what happens after 2 years, what happens after 10 years. So that then they keep on publishing after every few years, right? To know the actual consequences of taking medicine versus not taking medicine. And that is called randomized control trial. And these trial came in 1962. FDA, Food and Drug Administration, USA, they announced that any medicine to come in the market, first they have to go through randomized control trial. And also the medicine which is currently in the market, they also have to go through the randomized control trial, and till that time let it be in the market, and simultaneously let there be a randomized control trial. And all the medicine which were there in the market at that time, they went through randomized control trial, and the result came in 1972. That is a long-term result, 10 years of following up two groups of patients. And the result came that all the diabetes medicine, all, they are poisonous and they are killing people, they are increasing the mortality rate, death rate. So in 1972 when the result came, FDA decided that these medicines should be banned. After all, it is not improving the patient's life or the quality of life. That happened in 1972. But by that time the diabetes industry has grown to a size that it became a very big economy. So when something becomes substantial economy, when a lot of employment is associated with it, it cannot be closed down in one day. For example, cigarette smoking. Although the government knows, everybody knows it is injurious to life, it can kill you, it can give you cancer, but it is still surviving, it is still there in the market. Why? Because it is a big economy also. So the government, they think it is our responsibility, we cannot stop it, but yes, as a responsible government, what they do? They put a warning. Right? The smoking cigarette can be a cancerous or injurious to your life, and let the consumer decide. Right? So they give a clear picture, and now you decide. Clear picture, literally picture. In the picture on the cigarette packet, the picture of the cancer patients are there. You see the ugly picture kind of thing. So in spite of that, if you want to smoke, that is up to you. So they made you aware. At the same time, they are not compromising with the economy because of the cigarette industry. That is the point. So at that time, the same thing happened with diabetes medication. They decided, FDA decided, for every diabetes medicine, will write that taking diabetes medicine can kill you. It will increase the death chances. It is not good for your health. The similar kind of warning as it was in, as it is in cigarette boxes. But at that time in 1975, 40 top diabetologists of USA, they came together and they hired top lawyers of US to fight against FDA and to stop FDA from writing these two lines, cigarette smoking, like diabetes medicine is injurious to your health. So that was 1975. But the randomized control trial kept on happening. And recently, last 10 years, there have been some major randomized control trial, ACCORD trial, advanced trial, UKPDS trial, VADT trial. There are 4 major randomized control trial whose result came in last 10 years. And many of them result came in last 5 years only. And all the result together, it says only one thing, that when you take medicine, first of all, high blood sugar is not good, but in high blood sugar, if you start taking medicine, it is worse, right? So that as a result, it was so compelling evidence that 2018, that is last year, 6th of March, guideline of diabetes changed. It is called ACP guideline. Right? So American College of Physicians, ACP, the highest authority in the field of lifestyle disease. Right? It is bigger than ADA, American Diabetes Association. It is bigger body, bigger than IDF, International Diabetes Federation. Right? So ACP guideline, that is a guideline which was launched last year. I just told you the date. Do you remember the date? 6th of March, right? So, and that the guideline, if you see that there are 4 statements that released, and the first statement itself says that the doctor must make the patient aware that this medicine is not good for health, and it can kill, and it can make you more sick. and let the patient now decide whether they want to take it or not. That's the first statement, right? So, and similarly, there are three more statements, all shocking and surprising, and eye-opener kind of statement, which I'm going to include in this today's talk. But my question to you, so yesterday we had a similar kind of talk in Kuala Lumpur, right? So, and I keep on having this kind of talk in many places all over the world. So my question to you, it had been more than 1 year since the guideline has changed, but did your doctor update you about the new guideline? The answer I know is no, right? So if I talk of India, it is the responsibility of Indian Medical Association, IMA, right? So to release the guideline for the normal public. But on 6th of March, on 7th of March, Indian Medical Association, they collectively made a decision that will not implement the new guideline. Similar to what happened in 1975 when 40 doctors, they protested against FDA and forced FDA not to write the statement. Similar thing happened in India last year, that Indian Medical Association together, they collectively decided that we will abandon this new guideline. Because new guideline, accepting or implementing new guideline means telling you that you had been taking medicine for last 20 years because I told you, but now I tell you, don't take the medicine from tomorrow. So what is going to happen? You will lose the faith on the doctor. So because of you, I've been taking medicine for last 2 decades, and suddenly you're saying these are bad for you and you should not take it, right? So and that is a big business loss, right? So that is what is my assumption, is a big business loss, and suddenly taking a U-turn what you have been prescribing. So what I mean to say, in today's world, you have to be your own doctor. You cannot depend on the doctor for your own health. Now, in fact, the doctors are more sick than any normal public, you see. Right? A diabetes doctor, he is himself a diabetes patient, a heart doctor dying of heart attack himself, right? And that is very, very common, very, very common. So I took a survey a few years back in 10 top hospitals, right? And obesity department, head of department, they themselves, 9 of them were obese. So you see, there is no connection between the kind of treatment or kind of expertise he's having and his own health. There is no connection. So if he cannot cure himself, how can he cure you? He can treat you. That's why it's called treatment. Treatment is different from getting cured, right? So getting cured, only one person can do in this world, that is you yourself, because you are the one who stays with you for every moment of your life. So you should know your body more than anybody else. So now in India, the perception is that diabetes and obesity, it goes hand in hand, right? So India have been practicing, it is now more than 10 years. India about 8%, 8.8% diabetes patient, and mostly all of them were fat, and very high prevalence of diabetes type 1. You understand type 1? Small children with diabetes. Small children, every time they want to eat a food, they have to take insulin. Right? We take it for granted. Anytime, anywhere, we can eat whatever we like. But type 1 children, they cannot. First of all, whenever they need to eat, they want to eat, step 1, what do you want to eat? Oh, I want to eat 2 bread. Then the mother will calculate how much carbohydrate is there inside, and accordingly how much corresponding insulin body needs, and that insulin body is not generating, unlike what is happening in our body. And then the mother will feed the baby, inject the baby with the insulin, that quantity, that is calculated one, and now the baby is forced to eat 2 bread. Because if you eat only 1 bread and say, Mummy, I'm full, I cannot eat anymore, what will happen? Excess insulin, right? So he has to exactly eat the amount of what is decided for him, and that is kind of handicapped, right? And more children are type 1 than what you assume. When 1990, I passed out from school, 1991. So at my age, if you think of when you were going to school, how many children you know in your school life who were diabetes type 1? I'm sure that not a single one. In the whole schooling, not a single one. This term only you never have heard in your school life, right? But now every class, every section in the public school, you will find one diabetes type 1 child. I'm talking of India, one diabetes type 1 child. But majorly most of the parents, it is a taboo. They hide it. So maybe your neighbor child is diabetes type 1 and you may not know it. But I know it because many of diabetes parents, they come to me because diabetes type 1 is more critical than type 2. The whole life is in front of them, number one, and number two, every time they eat, they need to decide how much insulin to take, and that is really very miserable condition. So that is what is about India. And about 7 years back, I started a center in Ho Chi Minh City, that is in Vietnam. In Vietnam, diabetes prevalence is little less, but mostly the interesting thing is most of my diabetes patient in Vietnam is thin. They are thin. So there is a belief that if you become thin, you can become a diabetes patient, right? So here, why I am sharing this, because I want to tell you that there is no correlation between the amount of fat in your body and diabetes, right? So in Vietnam, the comparison, that there are less number of children with diabetes type 1 in comparison to India. And about 3 years back, we started a center in Kuala Lumpur, and that is in Malaysia. And Malaysia, the diabetes prevalence is double of India, about 16.5%. In Malaysia, there are two kinds of diabetes patients, my diabetes patient. One is fat diabetes patient and one is thin diabetes patient. As if it is a mixture of Vietnam population and India population, because Malaysia population, right? And so is the percentage and prevalence of diabetes, that is exactly double, right? That is combined and double, more than that, there is the prevalence of diabetes patients in India. So that is what I have seen. So here, based on those patients whom I have treated in the last 10 years, about 20,000, so their experiences and what I saw, the behavior of the blood sugar, so I know it is very easy. Whatever might have happened to you in the last 10 years, 20 years, whatever treatment you might be taking, it is easy to come out of it. Rather, it is very, very difficult to stay a diabetes patient. It is easy to come out of it and free yourself of diabetes. And how to free yourself of diabetes, that is what I am going to tell you today. So here, before, the first thing is that the diabetes you can cure, and it is possible only after stopping the medicine. Along with medicine, you cannot be healthy, right? Because while you are taking medicine, you are forcefully bringing down the blood sugar. So did you ever think that I took a pill went somewhere in the stomach, must be it has gone to the blood, and after a few hours I checked the blood sugar, it is down. Blood sugar is down. But where the sugar went? Magically it vanished from the blood, but where it ended up? Did you ever think about that? So the medicine, what it does primarily, it takes the sugar out of the blood and it hides in the heart, it hides in the kidney, it hides in the inner layer of the blood vessel itself, it hides behind the eyes, retinopathy, etc. So did you really want that? You never wanted that, right? So your body sugar remains the same. Your blood sugar has reduced, but body sugar content remains the same. What happened is, for example, imagine that before you came, this place was dirty. So my team to welcome you, we cleaned everything. But instead of throwing all the dirt outside, right? So we thought, let us hide it under the chair, because anyway you will not able to see, right? But what will happen in the first appearance? It looks like okay, it is clean. But when you sit for some time, it will stink, and then you will be uncomfortable. Getting the point, right? So the first appearance, you see the glucometer, okay, the reading is quite okay, but inside you are not comfortable. Symptomatically you are sick, right? You are accumulating more symptom, more disease, and more medicine. So when you take any kind of medicine, your blood sugar reduces, no doubt, but what about your body sugar? Why do you think that when I take a medicine, the sugar is thrown out of the blood and magically it is thrown out of the body also? No, right? Yeah, it is true, it is thrown out of the blood, but important is where it is thrown. Interestingly, it is being hidden somewhere, and wherever it is being hidden, that organ is the one which is going to suffer the most, right? So why the medicine will not work? Largely because it is just, I am taking the waste material from your eyesight and hiding somewhere in the room itself. So in real sense, I am not cleaning the room. Get the point? right? In real sense, I'm not cleaning. So you may get an impression at the first impression that everything looks to be clean, but in reality there is no change. Only thing is you're not able to see at the first sight, but after some time you may be able to feel it. The same thing happens in the diabetes with the diabetes medication. So diabetes medication is not a solution; it is rather a part of the problem, and that is not what is my opinion. Surely it is my opinion, but it is something which is medically proved, and that is why, because of this compelling evidence, last year the ACP guideline, the rules were changed again. And this happened before 1972. They tried to ban, but could not. Even now, in spite of it, it had been more than 1 year, but still you are taking the same medicine. So it is a proof that it is a medical industry, not a medical science. Right? Medical industry, diabetes medicine, and medical science says more medicine means more death, and that is what is happening. Accord trial, advanced trial, all kind of trial if you see, and the meta-analysis means all trial together and giving the final verdict. That's called meta-analysis, right? So why I'm sharing all these things, because something your behavior have been for last 20 years that every morning or every evening you're taking a pill. So we have to break that behavior, right? So this means, and that can be broken only with the evidences, right? So only then you will be. And it is not just with blood sugar medication, it is with blood pressure medication, with cholesterol medication, with blood thinner, all the medicine, one by one, all the medicines. Okay, so if I talk of blood sugar, diabetes, I have to talk of blood pressure also, because you will rarely find patient with diabetes only. Try to understand this. Right? You will not find patient, I am a patient only with diabetes. That is about 20%. 80% of the people who had started their journey as a diabetes patient, but eventually they collected heart disease, they collected hypertension, they collected kidney failure. So it is a collection of disease. So, and the first thing which happens is after diabetes is high blood pressure. Right, and this means about 73% patients who are taking diabetes medication are also taking high blood pressure medication. So whenever my patient, I treat the patient, I just addressing the diabetes and not addressing the rest of the things. This means ultimately he is in discomfort, right? So now we have to talk here about blood pressure also. First of all, what is blood pressure? If I ask you, or if I show you, high blood pressure leads to heart disease, or heart disease leads to high blood pressure. Which one seems to be true? Number one or number two? Okay, let me put it this way. You go to a doctor, and what the doctor is more likely to say? High blood pressure leads to heart disease, or heart disease leads to high blood pressure? First or second? First. Your doctor will say, oh my God, you are having high blood pressure, you will suffer heart disease, you will die of heart attack. That's how. Doctor will never say, oh, you are having heart disease, you will have high blood pressure. Right? It seems to be funny, the second one, right? Now let's try to understand from the beginning, and analyze it once again. Imagine it is a pipe, water pipe, and I put the pipe on the tap. I switch on the tap and the water is flowing through the pipe. I squeeze the pipe, water pressure will increase or decrease? Increase. Lesser the diameter of the pipe, more is water pressure. Very clear? Now imagine it is a blood vessel, right? Instead of water, blood is flowing. Now, because of the kind of lifestyle we are having, inside the blood vessel there is a blockages. When the blockage happens, the blood vessel diameter, it increases or decreases? So lesser the diameter, more the blood pressure. Blood pressure is higher. So when the blood pressure is high, that means there is some blockage already. And blockage is called heart disease. Right? 80% heart disease is because of the blockage. So blockage and heart disease are the similar terms. So now again you think, is it the high blood pressure which is causing heart disease, or the heart disease causing high blood pressure? First or second, which seems to be more true? Second. Since you are having since you are having heart disease, so it is leading to high blood pressure. High blood pressure is not the problem, it is the outcome, right? Like there is a fire alarm. So it rings means, it bells means there is a fire. Since there is a fire, so it is alarm is ringing. It is not because alarm is ringing, so fire is there, right? Alarm will ring only if the first is Fire has to be there. Alarm is not a problem. Rather, it is an indication, it is a warning that problem is there. Right? Try to understand. So, if you think that alarm itself is a problem and you cut the supply so that the alarm should not ring, so are you heading towards a solution? You are heading towards a greater problem, isn't it? The same thing happens with the blood pressure. If you try to address it from blood pressure point of view, so it is like you want to switch off the alarm. Right? Oh, alarm is disturbing me, I am not able to listen to the lecture. Let me first cut the supply so the alarm or switch off the alarm. By switching off the alarm, you are not doing anything to the problem. You are hiding yourself from the problem. The problem is still there. Right? So it is a warning. So high blood pressure is just a warning. It is not the problem itself. So where we need to address, if we can do something to break that clot, so the blood pressure will reduce, and blood pressure reduces means the blockage is gone. The kind of blood pressure medication which you are taking, do you think it does anything to reduce the clot blockage? No, we know that. So how it is reducing your blood pressure? It is working on heart, it is forcing heart to work less. Right? So what happens when we grow old? Your heart works less. The same thing it is doing, but you are not growing old, but it is making your heart old. So already there is a problem, that there is a blockage, and the top of it, what you are doing, you are adding the problem by making it work less. So this means two problems. Right? So when you take a blood pressure medication, so in reality, what you are doing, you are increasing your problem. You are adding a problem. You are not solving the problem. So like blood sugar, it is blood pressure medicine also, that it makes the thing more complex and it makes you more ill. It is not a solution at all. A question can come in your mind that if these medicines are so deadly, why do still doctors they suggest it? So to know the whole story, we are having limited time, so I'll spend more time in the solution rather than about the problem, which I am only 5 more minutes on the problem, then the rest of the time we'll work on the solution, what we can do and what we should do right now once we go back. What's in our hand, that's more important. But if you are curious about the whole conspiracy story, I suggest you that you go to the website called alltrials.net. Number one journal of the world, it's called British Medical Journal, BMJ. In 2016, they started a campaign called alltrial.net, and in this campaign, they started exposing each of the medicine one by one. Because one clinical case study came, that is half of all clinical trials, the spelling of trial is wrong, never published. Half of all clinical trials never published. That came in that is a reality. This means whenever the clinical trials happens, the bad side or the negative side or the side effect of the trial, that is being hidden by the pharmaceutical company so that they get a clearance from FDA. So now, British Medical Journal, since 2016, they started exposing all this medicine, the kind of medicine which is popularly consumed by the world. So here all the stories and conspiracy will be there. So that you can of course read, and to satisfy yourself that before you take the next pill, try to understand if it is a blood pressure medicine, if it is a blood sugar medicine, it is not going to help you. It is going to help only those people who are selling you the medicine. That is for sure. So what is high blood pressure? Imagine a snake comes suddenly. So what will happen? While talking to you, my attention will go on the snake. I will just jump, I'll be frightened, and my heart start beating fast. And at this point of time, if you read my blood pressure, what will be the blood pressure like? Very, very high. So will you label me, oh, you are a high blood pressure patient? Certainly not. So when my blood pressure is very high, actually certain kind of hormone is circulating in the body, and that is making me more alert so that I can protect myself from the snake. It is an alarm for me. So high blood pressure. High blood pressure is a signal that there is a danger around. Right? Now, a zebra in the jungle, suddenly zebra could sense there is a tiger around. What will happen? His heart start beating more. Right? So, and now he is able to see more clearly, he is more alert, he is able to hear more clearly, and he is preparing, his body is preparing for himself for fight or flight. Right? So he is in a different mode, more alert mode, he is not casual, right? he is not relaxing. So at that time his blood pressure should be very high. So blood pressure is like an alarm that danger is around. It is preparing your body for the expected danger so that you can protect yourself. It is not a disease. It should not be classified as a disease. So what happens to you as a human? When you go to the doctor, the moment you look at the doctor, your blood pressure becomes high. Right? Older the doctor, more is the blood pressure. More expensive is the hospital, more is the blood pressure. And now doctor checks your blood pressure. Look, your blood pressure is high. Certainly high. But who is responsible? The doctor is responsible. Right? You escape from the hospital, come back and blood pressure comes down normal. Right? This is known as white coat syndrome. The moment you see, there are people, about 80% of you, the moment you see white coat, your blood pressure shoots up. 80%, right? American Journal of Cardiology, 1987. So 80% of the people who are taking blood pressure medication, that is not your real blood pressure. The moment somebody tries to check the blood pressure, the very thought that somebody is testing my blood pressure itself brings the blood pressure high, right? It is kind of danger kind of thing which you have associated already, right? So threat. So it is not your real blood pressure. It is only during the testing time your blood pressure is higher, but normally, and that is up to 80% of the people, among the people who are taking the blood pressure medication. So blood pressure is not a problem, right? But trying to reduce it, that can be truly a problem. And if at all your blood pressure is very, very high, there can be underlying cause. You have to address the cause, and if you can do it, then you can solve the problem. But without addressing cause, if you just take randomly the pills, you are increasing your problem, and surely you are increasing your problem. Now you see, if I ask you one question, what do you think is the normal blood pressure, standard blood pressure? Any answer? 120/80. Wherever I go, whichever part of the world I go to UK or Switzerland or Vietnam, even Bangladesh, India, here also. Yesterday also I asked the same question. The answer always remains 120/80, right? So now you see, in the world, the highest living people who have the longest life is Norway population, about 80 years, and their average blood pressure is 150/90. Now imagine a doctor from Singapore goes to Norway. So what he will interpret? My God, whole population will die of heart attack. Let me bring down the blood pressure, right? So that is how they will react, but that is very much their normal blood pressure. So on the other hand, in India there is a small island called Andaman Nicobar, and there is a tribe called Jaravas population, and if you check the blood pressure, it is 100/60 most of the time, 100/60. Now imagine a doctor here is posted in Andaman Nicobar Island. Now you see, oh my God, they are all going to die. We must do something to bring their blood pressure up. Right? So when you chase any particular number that I have to achieve particular number, you are going to die early. Right? So the important thing is, am I comfortable? That is the most important thing. So what I understood, what I learned in last few years while treating my patient, that you need not to chase a number. At what number you are comfortable? For example, it is like a size of shoe. Everybody will not have the same shoe size. It will vary, right? But you do not see what is the number. You just wear it and walk it. If it is comfortable, it is your shoe size, isn't it? Right? It is not that you decided my shoe size is 9, only 9 size I will wear. That's all, right? Whatever may be the comfort level. You don't do it, right? You wear any shoe, and if it is comfortable walking, that becomes your number. Right? So the same way is the blood pressure. So don't chase by number. The moment you chase by number, you are taking a different track. You may be able to achieve your number, but you may not be able to achieve the health. And mostly we have associated that health and number are same. Let's say you just told me 120/80 is the standard, and a doctor will say try to bring your blood pressure to 120/80 and your chances of living is higher. So what I do, I make some changes in my body and my blood pressure remains exactly 120/80 at every moment. 120/80 at every moment. Doesn't go up, doesn't go down. Right? Now just imagine what will happen. Suddenly I see a snake. What will be my reaction? Well, let it be. My blood pressure is 120/80. This means my brain is not triggering any alarm. Right? This means my brain is saying everything is normal, don't worry. So try to understand blood pressure is also connected with your emotion. right? Feeling of emotion, good or bad. So the blood pressure is a reflection of how emotionally you're feeling. The threat, right? The threat threshold comes with the change in the blood pressure, and change in the blood pressure also is related to the kind of hormone which the brain wants to release and circulate in the body in few seconds, so that you immediately feel the threat or immediately feel happiness, immediately feel a particular kind of emotion which may be required for you at that particular time, right? So blood pressure, what is your blood pressure? Suitable blood pressure, the blood pressure at which you are comfortable. So it is nothing to just chase a number. So now I just told you ACP guideline 2018. At the end I will give you the link. Whatever I am giving the references, right, off and on, of some journal or some case study, some trials. At the end I will give you the link, and in that link I have collected all the journal report which you can go and you can satisfy yourself more. That is one thing. And second thing is, in this journey today, in next 1.5 hours or so, you may be having a lot of queries, a lot of questions, a lot of confusion, a lot of doubts, where you may not agree with what I am saying. So don't accept because I am saying. If you have any question, any doubts, you keep on writing, and at the end I'll give you opportunity, 10 minutes, 15 minutes, whatever time is available, so you can clear the doubts. You can question. You must question. After all, it is about your health, right? It is making a new decision about your health. So you should be satisfied. So now, as you see, the guideline changed. Similarly, the guideline of blood pressure also kept on changing, but for a negative reason. So before 1993, had I asked what is the normal blood pressure, so the answer would have been 160 by 100. JNC, Joint National Committee Report 1993. So anybody having blood pressure more than 160 by 100, they are only warranted for medication. So, but after that, 1993 onwards, it became 140 by 90, and now you are saying 120 by 80. Maybe within few months it will become 115 by 75. And once it happens, only those people will be called healthy, those who will not check their blood pressure. Anybody checking their blood pressure will come back as a sick patient, only taking a lifelong medication. So here you see the trend. And it is not just the trend of blood pressure medication or blood pressure diagnostic, the trend of blood sugar also, the trend of cholesterol also, the trend of thyroid disease also. With the time, what is happening? The diagnostic parameter are getting squeezed. So this means more healthy people are converted into a sick patient. It's like you are playing a football match and you don't want to lose, so what you are doing, every time you get a chance, you are making your goalpost smaller and smaller and smaller. A time will come when a goalpost is so small that it is even smaller than the size of football. This means even a world's top football player cannot win against you, because only your side is smaller, his side is okay, the same size, right? So try to understand that about 20 years back, before 1993, think of the day before 1993, how many people taking diabetes medication you can recall, and now you see how many people you can think after 40 years of age, those who are not taking diabetes or blood pressure medication or cholesterol medication or blood thinner medication, right? So you will roughly able to understand the whole conspiracy of over-medicating the world, right? This means it is assumed now by medical industry that nobody can remain healthy after 40. If at 40 years of age you go to the doctor, you will come back with some medicine, right? Or it is called general checkup. Yearly checkup. Mostly it happens in government offices or corporate world. Once in a year checkup. That is just to increase their business, right? So converting the healthy people into sick people. So recent report this year, 2019, Cochrane. Remember the word COCHRANE, Cochrane collaboration. Cochrane is one very authenticated organization. It started 1996 or so, and that keep an eye on the medical science, what is happening around. It is being recognized by more than 150 countries, sponsored by more than 150 countries. India is one of the sponsors. And Cochrane, they don't associate themselves or they don't accept any funding from a private person or from a pharmaceutical company. And Cochrane, they kept an eye on the people who went for annual checkup for last 10 years and the people who never bothered to have any kind of checkup. And after 10 years of keeping an eye on lakhs of people, 100,000 people, they came to the conclusion this year, the people who went for checkup at least once a year, they are the one who died faster. So rest of the factors remain the same. Their economic factor and their lifestyle, everything remains the same. Only one thing different, that these are more curious about their health, and once a year they go for the checkup, and these they don't bother to check up. So that is one new tip, and the result came this year only. But anything which is not recommending medicine are the thing which comes in the journal, but it never makes its way to the normal media, right? Because normal media, you see, these days are paid media. Whoever need to publish anything, they need to first pay some money, only then it comes. But if it does not come in the conventional media, it does not mean that it is not true. If it has come in medical journal, that itself means that it is having some standing, especially when it is released by Cochrane collaboration, Cochrane. The nearest central Cochrane collaboration is Penang, that is Penang Medical College in Malaysia, right? So in Cochrane database, if you check, I think for India, Malaysia, I think for Singapore also it is free. The citizen can freely access the Cochrane database. So there you will find a lot of striking answer or relevant answer which can help you in making a decision. For example, if you ask, see the Cochrane collaboration, after what blood pressure I should be taking medication, the answer is Cochrane 2012 report that says if somebody's blood pressure goes more than 160 by 100, only then the medicine may benefit you a little bit. But if you naturally maintain the blood pressure less than 160 by 100, this means you need not to take the medication. And by taking medication, you are doing more harm than any good. So whether I talk of Cochrane collaboration, 2012, whether I talk of 2018 ACP guideline, or whether I talk of this year, 2019 American Heart Association new guideline. 2019 March new guideline, and according to this new guideline, that many new things were there, but one of the very striking thing was about aspirin. So mostly you have seen that if you are taking diabetes medicine or blood pressure medicine, so automatically doctor prescribe you aspirin also, blood thinner also, isn't it? Right? But the new guideline says, which was implemented in European guideline in 2016 already, right? 2014 FDA already announced, but at least American Heart Association this year they also announced, and that is, if among you those who are taking aspirin, ask yourself, had I have any heart attack in the past? Answer is no. Ask yourself, did I have any brain stroke in the past? Answer is no. If both the answer is no, you don't need aspirin. New guideline, try to understand, right? This means if you never had a heart attack, never had a brain stroke, still you are taking aspirin, this means you are making your life more miserable, you are injuring yourself inside. What happens when you take aspirin? It makes inflammation in your stomach, that inflammation becomes ulcer, and if you continue taking it, it becomes cancer, and people die of internal bleeding, people die of cancer. It is true that if you take aspirin, your chances of dying of heart disease reduces substantially. Because it's not because it helps the heart in some way. It is because before you die of heart disease, you die of internal bleeding because of aspirin side effect. So pronounced the aspirin side effect is that this year American Heart Association, they were forced to change the guideline on aspirin. Just imagine, aspirin is the oldest modern medicine. Oldest, right? It was discovered in 1890, right? Oldest, more than 130 years. And after 130 years of promoting aspirin and most widely prescribed medicine, and now a complete U-turn, so you can well imagine the uncertainty around the medicine. And it clearly states, you can see, this means you cannot have faith on medicine. And any medicine when you take for long run period, it is certainly going to injure yourself. So there has to be some way to come out of it. So here, before I go to solution, only one last topic, next 2 minutes I'll spend and then jump into solution. Because currently what you are doing is not a solution, I just want to impress on that. So when you talk of diabetes medicine, blood pressure medicine, one automatic third thing comes cholesterol. You start with any one of them, it will pull other two. Which one will come first, it depends on person to person, but at the end you are taking all the three combination. Now, when you take high cholesterol or cholesterol lowering drug, if I ask you what is the name of the drug, you will call it statin, some kind of statin, right? That you already know. But what statin can do? FDA warning 2012. It can cause memory loss. It can cause diabetes. It can cause muscle damage, and it can cause erectile dysfunction. It can cause heart disease. So those are the warning given by FDA. Now, FDA responsibility is to give the warning, and now it is up to you and up to the doctor whether you follow the warning or not, but that is true. If you want to know the truth of it, you just go to the doctor and ask, doctor, what is the scientific name of statin, cholesterol lowering drug? What is the scientific name? Doctor will say statin, but statin is a nickname. What is the scientific name? Scientific name. So you can Google and find scientific name. The scientific name of cholesterol lowering drug is, it is called HMG coenzyme inhibitor. HMG coenzyme inhibitor. It is not called cholesterol inhibitor. Inhibitor means stopping, right? Stopping, right? It is not called cholesterol inhibitor, although it is promoted as it lowers the cholesterol. But in reality, it does what it does. It lowers HMG coenzyme. HMG coenzyme. What is this? It is a kind of chemical which your body produces. Right, our body produces a chemical called HMG coenzyme, and HMG coenzyme in turn it kickstart a kind of chemical pathway called mevalonate pathway. And when it happens, a series of chemicals are produced by your body because of this pathway, right? And one of them is cholesterol also. So when you are taking cholesterol lowering drug, that is called statin, so what is happening? You are breaking the pathway here. You are stopping this to work. This means this pathway will not be produced much, and ultimately cholesterol production by the body will increase or reduce. It will be decreased, right? So it is decreasing the cholesterol not directly but indirectly. Are you getting the point? Right? So, but how? By forcing this mevalonate pathway not to happen or to happen in a lesser quantity. So reducing the quantity of cholesterol production by the body. Now here the important thing you have to understand that what these are the chemical produced by the body, and these are having a specific role in the body, definitely. That's why the body is producing it. I'll give you how important these can be with one small example only, and that is among all the muscles of the body, which is the muscle which never get tired, which never stops working? Heart. Right? You see the muscles of the legs, of the hand, with little bit of working you get tired, you sit and you relax, and then again it regains its energy. But unlike that, the heart muscle, when you are born, since that time till now, it is pumping, it is working, right? Do you want to give it a rest? Right? Oh, you have been working for last several years since I am born, take rest few minutes. You cannot dare to do it, right? Then you will be on a permanent rest. So, did you ever think, what is so special about heart muscle that it never get tired? The answer is very clear, and that is, it is the CoQ10. You see the second chemical here? It is the CoQ10. This is the kind of chemical which gives the strength to the heart, and as a result, it never gets tired, it can beat continuously, and that is why we are alive. Now, when you take statin, this medicine, what is happening? It is not only reducing cholesterol, it is reducing the quantity of this production also. Now, all the patient, and if you are the one who is taking cholesterol lowering drug, you yourself can be a testimony that once you started consuming it, within the first 2 months, you reported to the doctor. For most of you, doctor, since the time I'm taking cholesterol lowering drug, I get tired too easily, right? I get tired, I get fatigued, muscle pain, even erectile dysfunction. So doctor will never relate that is because of cholesterol lowering drug. Doctor will say, okay, I'll give you one medicine. The name of the medicine is CoQ10. So try to understand that what you're doing a direct harm to yourself by taking cholesterol lowering drugs. So cholesterol lowering drug is not a cholesterol lowering drug, it is an HMG coenzyme inhibitor. And since it is HMG coenzyme inhibitor, and you see all these chemicals, each one of them plays an important role in immunity, important role in cancer cure, cancer prevention, and so signaling system. So these all are kind of things which contribute to your immunity directly or indirectly. So when you are taking statin, you are making yourself more prone to various kind of illness. So Surely statin is something which is so poisonous. Actually, it is from where statin came. Uh, there is called red rice plant, which found mostly in China, and God has given a special gift to red rice plant, and that gift is that when some predator or some small insects want to eat that plant, the plant can throw a small poison on the insects, and insects die of the poison, and that poison is called statin. So the American soldier, they got this poison and they thought that let it be of some use to kill our enemy. And later they gave it to scientists, and scientists, they found a business out of it, and that is what is known as cholesterol-lowering drug. Right? So it is a poison gifted by the God, by the nature, to a particular kind of plant, so that it can protect itself from the insects. Right? So it is given in a small diluted form, so it is not going to kill you in one day, but at the same time it will kill you little by little, and what happens that you start collecting more illness, heart disease medicine, right, blood thinner, etc., and your impotency medicine. You see, these days, especially Singapore, there are so many infertility clinics, which was not the challenge about 20 years back. Right? That was never a challenge. Now I see in my office, whether in Malaysia or India or Vietnam, youngsters, they come with the challenge of they are not able to produce babies. Right? So, so many things are happening around. So this is all about the problem. Now, with this understanding, what is the solution? When you go from here tomorrow, today, so tomorrow what you should do? So for solution, what we have to do? Here, let me just complete one slide. You see, did you see this movie, Pa? Pa is this is a son who looks like a father, right? Why? Because a kind of disease, Hutchinson-Gilford syndrome, and this happens to about, for every 2 million children, one child suffers from this disease. And this disease happens because the child's body naturally is not able to produce this mevalonate pathways. So the child, for every 1 year, the child grows by 10 years. So this means 8-year-old child will look like 80 years, and that is a real, you will see 80-year man, right? So, but the memory, the brain is of the child because he is a child, but he looks like 80-year-old man. Right? So try to understand, when you're taking cholesterol-lowering drug, you're forcing yourself to become old very, very quickly. Right? So the unfortunate children, those who are born without the body's ability to produce it in a good quantity, they are the one at the age of 8 years, they look like this. Right? Indian Bollywood movie made with this concept called Pa. Right? So that is one poison which you should not eat. Right? So when you go back, the first thing you take out, and even don't throw it, right? Because even the animal may eat it. Right? So you just destroy it, and find an innovative way to destroy it or hide it somewhere. Right? If you are a diabetes patient for more than 10 years, if you are an insulin dependent patient, and if you are on multiple therapy. So for these kind of patients, my recommendation is, step one, first is, once you go back home, you go to this link, bishwaroop.com/reference. And whatever references I gave today, many of the references are there in these 3 books. So by going to this, you can download the free ebook, all these 3. So first download this and upgrade your knowledge about what is true and what is wrong, what is the evidence-based science. And one very interesting book I want you to read, it is called Why the Mortality Rate Drops When the Doctors Go on Strike. It is seen all over the world, when the doctors are not working, when they are on strike, the health of the population start improving. And when the strike ends and when doctors resume their work, again the people get sick. Right? So, and it is in British Medical Journal. I just collected all the data, and then I analyzed the data with the American Harvard scientist Leonard Horowitz here, and together we wrote this book. And when this book came, I have written about 25 books, but this book, no publisher, they they agreed to publish. So I had to self-publish the book, and from the name itself you can understand it can be a threat to the publication. So publication they did not. So I have self-published book. So since I have self-published it, so it is easy for me to circulate it freely. So you must read this book. So the first step is you must upgrade yourself with the knowledge, and that will tell you again and again that if you are on so many medication and insulin, you are heading towards getting killed, right? That is like suicidal. Now, for this kind of patient, I say that whatever my recommendation is, that if you start following that diet, so that means from tomorrow your body will start producing insulin, and if your body starts producing insulin, this means the kind of insulin you are taking, that you have to correspondingly reduce, taper down. But how much to taper down? Many times I have seen my patients, they are not able to decide on their own. But I, as an expert seeing thousands of patients of similar kind, I know exactly how much insulin I should reduce in this particular patient to get the best outcome, right? So that is always a problem in this particular, with these kind of small group of patients. So I advise them that rather than doing at home, independently on your own, you should do it under the supervision of some expert. And when I say expert, I don't mean doctors, because in their 7 years of medical study, they do not have more than 7 pages of study on nutrition. So they are not the right kind of people to ask which nutrition, which food and what quantity. They will never tell you, or they will never know when you eat certain kind of food in certain quantity, how much fluctuation will be there in blood sugar and blood pressure, and accordingly how to taper down the medicine or how to adjust the dosage. So that's why we started the camp, what we call as diabetes residential camp. So they are the right candidate who can join my residential camp. Our residential camp is normally of 3 days. And here one interesting fact is, and we put it is called continuous glucose monitor. It is like a chip which we stick to the surface of the skin, and it monitors the blood sugar every 15 minutes in the chip. And this means I can check the blood sugar through computer of the whole day. Now important is, when you check through glucometer, what happens? You check the blood sugar for that moment of that 1 drop of blood sugar, 1 drop of blood. So that is not your blood sugar level, that is the blood sugar of that drop, right? That is not reflecting you, it is just 1 drop. You can do an experiment tomorrow. You at the same time you take the drop of blood from each of the finger, 5 finger, and check the blood sugar. And you will be surprised that each of the number will be totally different. Yeah, anybody did this? If you do it, you will find one is showing 6 millimole, one is showing 8, one is 11, one is 7. Right? Many times patients come to me, doctor, which one to believe? I say the one which is the lowest, you believe that because that will make you happiest. Right? So here I mean to say, these are so approximate, these are just random, that it can, based on that you cannot decide what should be my insulin quantity I have to take from outside, right? So you cannot judge. So we put a continuous glucose monitor, and interestingly, those who are having high sugar level in the morning, in the whole day, in the middle of the night, maybe at 3 a.m. or 2 a.m., it dips down. And when it dips bottom, about 4 millimole per liter, that is a dangerous level, then the liver throws some sugar on the blood so that it can jump up. So, but then when you get up at 6 a.m., you see your fasting blood sugar very high, you worry. But your fasting is high because with the influence of medicine, it has gone down. As a compensation, liver threw some sugar on the blood, and as a result, the blood sugar is showing high. So since you can see only high blood sugar, you will decide to increase the medicine or decrease the medicine. Increase the medicine. But when you increase the medicine in the middle of the night, the blood sugar will drop further. So what will happen? It is like more hypo. It's like rebounding of the sponge ball. You throw the ball stronger, it will bounce back even higher. The same thing happens, but what you don't see is what is happening the whole night. What you just see is the fasting blood sugar. So basing your insulin, how much insulin you need only on fasting blood sugar or taking the drop of blood, that is not a scientific thing. That do not give the real picture. And that is doing more damage, more harm than any good. So, and from second day, we start tapering the blood pressure medication, because we know by second day the food works on the blood pressure side, and that means able to taper down, able to make some blockage smaller. So second day onwards you can expect that your blood pressure will drop down and you can accordingly taper down the blood pressure medication. And similarly for heart patient, for some heart patient we take the heart sound, we record the heart sound. And after 1 month we do the follow-up for some patients. And one is the most important diagnosis I always tell is the symptomatic. Are you feeling more energetic? Are you feeling more healthy? Is the pain reduced? If you are having a better sleep, a better digestion? So these are the better way to diagnose. And then keeping a record. After 1 month again we check the heart sound and we compare the two heart sound, and that is secondary kind of diagnostic. But the most important diagnostic which where you should depend on, that is what your body signifies, what your body indicates, the signaling from the body. Your body is talking, your body is telling something to you, and that is the best diagnosis. Maybe in diagnostic parameter everything is coming perfect, but you are in pain. Which one you will believe? The paper or the pain in the body? Certainly the pain. So that is the main important diagnostic. So these are the three steps which we do in the 3 days of residential camp. And this is kind of one of the camp picture. And the next program is here. So this is all about my presentation. And first of all, thank you that you patiently heard me, right? And now comes second part of it. I am sure that you may be having a little bit questions and doubt and confusion about whatever I taught or whatever I shared with you in the last 2 years, 2 hours. If you have any question, you can ask now. Yes, please. Yeah. Yeah.
Can the date be away from 14 February?
Yeah. Here you see, for most of you, you do not need this date, because by the time this date will come, most of you will be cured already. Since you start following it from tomorrow, right? So I'm not looking at that all of you or some of you will come. But these are the dates that is there, right? So that me and Mukhtar will do some business out of it. But truth is that for 90% of you, you don't need these dates. You can get cured on your own. Yeah, maybe next time when I come, you come to meet me not as a patient, but just to say yes, I got cured, right? So about the details of it, Mukhtar or Grace will tell you the details of it. But what we discussed in last 2 hours, if you have any question among that, right, so that you are able to follow properly my guidelines, you can ask. HbA1c. Yes. Yes.
How that will correlate?
Yeah, it very much correlates. What happens, we also ask our patient, for example, the patient, when they join, we take their HbA1c. Along with that, we have a machine in our tour. We take a fresh HbA1c and then we ask them that after 3 months, about 90 days, we call them and they have to send their HbA1c again. So that is the second follow-up. First follow-up we do after 15 days. The chip which we put, this chip lasts for 2 weeks. And after that they take out the chip, it is like a sticker, and then they send it through courier. And in that 15 days after you went back to your home, how was your body response to the new food? I can come to understand through the graph, through the chip. So the first follow-up we do after 15 days, and the second follow-up we do after 3 months. And the important thing is, you are right, HbA1c is a true indicator about your status of blood sugar in comparison to the random blood sugar check. So we also monitor that, and we also look at it that it should come down at the same time. You should be medicine free. Yes.
Your plant-based diet, what is the sugar? You need grains, you need what?
Yeah. Here I will tell you 2 things. First of all, this itself is a complete food, and I am a testimonial. I am eating this way for last 12 years, right? Yeah, maybe the grains which you are talking, someday I eat that also in a very small quantity, because sometimes we go for somebody's has invited me for lunch and I say no, I will eat this, I will eat raw food. It looks rude, so I eat sometimes just to satisfy the other person. Otherwise, mostly I eat this. Number 1. Number 2, I told you that 70% you eat this, and 30% is you can eat grains, you can eat rice. So you're still eating rice, you're still eating grains, you're still eating your bread, But I am just saying you add a lot of fruits and vegetables in your lifestyle. You add on it. I don't want to reduce. Yes, I want you to reduce animal protein that is there, but you can add grains. Grains are there in the same amount. You need not to reduce it, but you increase this. Yes, please.
Well, a number of questions. First one is diabetes reversal. Does reversal mean treatment or cure? And is it short term or long term?
Yeah.
That's my first question. Second one, is ladies' fingers good, especially for diabetes? And my third question, you mentioned don't take milk and dairy products. How about eggs?
Yeah. First of all, let me answer the third question. It is very shorter, so I'll answer in 1 second. So, dairy products, that is having animal protein and eggs, you ask yourself, does it come from animal or plant? So, the moment the answer is animal, this means not good. So, whenever you are confused, you see what I am going to eat, animal or plant. If it is animal, don't eat, right? So, that is, now about the lady finger you are talking about, any vegetable. I did not specify any fruit or vegetable, I said vegetable. Any vegetable and many vegetable of variety of colors is equally working on your blood sugar. So that is even better that you can choose. Somebody may not like lady finger, will not eat. Somebody you like potato, right? So you, when you eat a lot of potato, in steamed form or boiled form, it controls the blood sugar. But when you fry it, it increases the blood sugar. So same vegetable, lady finger, if you fry, it increases the blood sugar. But if you eat in steamed form, boiled form, it decreases the blood sugar. So it is not about what you are eating, it is what in what state you are eating, that also you have to consider, right? For example, maybe you take a Tropicana fruit juice. It is a fruit juice, but it will increase the blood sugar. But when you eat it in raw state, nature state, it will decrease the blood sugar, right? Now the reversal and cure. Reversal means that without medicine, you are able to maintain the same blood sugar number as you were maintaining with medicine, right? For example, with medicine you are maintaining a blood sugar about 10 millimole per liter. From tomorrow you make some changes in lifestyle and you throw the medicine and still your blood sugar is 10 millimole per liter. That is called reversal. But then if you don't follow this guideline, again your blood sugar jumps. This is reversal, not cure. But cure is that if you deviate from the guideline which I gave you, and sometimes you cheat around, you eat something which is known to be increasing blood sugar, still your blood sugar under control, this means it's a cure. So the first stage, 3 days, the reversal is possible. But if you continue that lifestyle for 3 months, then it is a real cure. Real cure means after 3 months, if you eat anything, say if you eat fried, if you eat animal product, protein again, so it is not going to increase the blood sugar immediately. It will take some time, some months, some years to again make the same amount of damage. So cure will not happen the 3rd day, reversal will happen 3rd day. Cure, my experience is if you continue similar lifestyle for 3 months, 4 months, then comes the stage cure. Yes, please.
Good evening, sir. Since I was talking about blood pressure, diabetic, and cholesterol matter, I wanted to ask a question about cardiovascular matter. Since I saw your YouTube, so person went for the open heart bypass surgery and also went for a stent. Okay, that subject you haven't touched on it, so I need to ask you this question. In the YouTube, you're telling that I'm taking two blood thinners. So you say that stop the blood thinning and
Yeah.
only one word stop the blood thinning. I don't know what are the alternatives to replace, because you're talking about taking garlic pills. They say you interfere the blood thinner. You're taking omega-3 also, blood thinner, and honestly, omega-3 got 2 types. One is a fish type of omega-3, and one is a plant-based omega-3.
Yeah.
So all these things are not clear at all, and all that. That's why I need advice.
Yes, yes. Yeah. So if you go to my YouTube channel, you will see a lot of videos on cancer, on heart disease, right, on all kind of illness, on viral infection, viral disease, on dengue, on H1N1. So all kind of, you will find video, more than 100 video, 150 videos are there, right? So, but today the topic was food as medicine and mostly towards diabetes, hypertension. But since you asked the question, let me answer the question. So, the cardiovascular disease, those who are already having stent and those who already have a bypass surgery, like Bill Clinton, right? So here, what he said, that he started following it, and slowly, he started improving, and finally he became free of medicine, free of all kind of side effects. So my instruction for the heart disease patient remain the same. Assuming that you or somebody you're talking about is having stents and also had a bypass surgery, my instruction for you remains the same. Now comes the aspirin part, right, blood thinner part. Here I told you, according to the new guideline, if you already had a bypass surgery or a heart surgery, normally it says if you have a heart attack or if you had a brain stroke. But what happens when you go for these kind of surgery, the amount of damage happens while you are doing surgery is similar to the heart attack itself. So I extend it, if you have any kind of surgery, heart surgery, then also you have to continue the aspirin, number one, right? But 2 blood thinner, it is truly dangerous. But why 2 blood thinner is given to you or that patient you are talking about, for that matter, I need to see all the report. Then I cannot give a generalized answer because it's too critical, right? So that's what we do in our diabetes tour. We ask the patient to send all the report about few weeks back, and we read it, and then we make a customized diet and customized medicine plan for each one of the patient. So that answer to this question comes in a complicated range. The diet remains the same, no doubt, and had I been the doctor, I would have said only 1 aspirin, that is a baby aspirin. But if it is 2, that means that the blood is getting too thin, and that is substantially dangerous.
The second one is after the stent. After the stent, take for 1 year, the doctor's advice. The second,
After stents,
after stent, they give the second blood thinner, also to take 1 year.
only 1 year. So there is no logic why it is 1 year. Why there is no logic? I could not see any logic. Number one. Number two, you have to really understand, when anybody have a stent, that is a foreign matter in the body. You understand, right? Like metal is a foreign metal, foreign for the body, foreign element in the body. When there is some foreign element in the body takes it as a that body wants to hide it. To hide it, body throws all kind of cholesterol, all kind of calcium to hide it, and that hiding process itself becomes a blockage. So normally it is seen on average, having a stent, it within 2 years to 3 years, it accumulates into a new blockage, and then again intervention is required, as happened in Bill Clinton case, as it happens with most of the people with stents. So stents is not a permanent solution, it is just a temporarily you have done something for even more aggressive treatment in the future. But now, if you eat this way, what will happen, as Bill Clinton told also, on one side the body is forming blockage because you want to hide the stent. On the other side, while you are on this food is producing nitric oxide, and nitric oxide it starts reducing and clearing the blockage. This is Nobel Prize winning science 1998, right? So to answer your question, that you start eating like this, and if you start eating like this, it will take care of the blood thinning effect also, it will take care of the blockage also, it will ensure that the next blockage will not come. So again the question comes, should I stop the blood thinner? Yeah, if you want an answer in yes or no, I'll say, okay, you have to have only 1 blood thinner, not the 2, and that too a baby aspirin. Baby aspirin is, I think in India it is 81 mg, here it may be 75 mg. In different country, baby aspirin is having a different combination. So, but again I say, for critical case like this, I really need to read the complete story, and then only I give a responsible guideline. So it cannot be generalized, and it takes a lot of time to see one patient's history, his metabolism. Everyone is unique, right? So that's what we take more personalized approach to the patient. That's why for some patients who are critical patient, critical means a lot of intervention already happened. This means the patient is very delicate already, not because of his own health, it is because of those intervention. This invasive process itself is having its own danger, own side effect. So that's why I avoid giving any generalized comment on it, right? Yeah, so one by one, yeah. I'll come back to you again.
I eat a lot of fruits, but most time I juice it. Does that reduce, by juicing, does it reduce the effect?
Yeah. This is, let me tell you, first of all, can we juice it or not? The answer is you can juice it, but when you drink the juice, let's say sugar cane, good for diabetes patient or bad for, I say good for diabetes patient. Sugar cane, when you eat it, but someday, okay, if I juice it, if you juice it and drink it, so keep in mind, had you eaten it, how much time you would have taken to eat this amount of juice. So you have to spend that amount of time while drinking it. So let's say you're drinking orange juice. So 4 hour big orange makes one juice, right? So one day you eat all the 4 oranges, you see how much time it is taking to finish all the 4 oranges. Let's say it took 20 minutes to finish all the 4 oranges. This means next day when you make a juice of orange, you must take 20 minutes to drink that. Right? So that is the first thing. Yes, you can juice it, but if you are juicing it to save your time, no. If you compromise in time, when the sugar it hits the stomach quickly, you see it is a fruit. I call it engineering. God has engineered the fruits in such a way that assuming that humans are going to eat it and drop by drop sugar is going to hit the stomach and there is a particular pace and speed it will add up to the blood. God never knew some intelligent people like us will juice it and drink it, right? So, if you juice it, first of all, you must not sieve it, it should have a lot of fiber, and secondly, decide to drink it very slowly, and good effect is there, but not in comparison to eating it raw. Eating it raw, 100% effect, and drinking, juicing, 70% still good effect, but with these conditions. So, one or two question more, yes. Yeah, that's what I said when I asked for the same question for egg. You take it, ask from where it came, animal or plant. You answer, animal, I will not eat. I don't know you are talking yogurt or egg, whatever name it is. You ask yourself, does it come from animal or plant? Animal, I will not eat. Simple.
So
right?
the filled milks are okay.
Huh?
There's some milk called filled milk, I think, which is not from animal, right?
Huh.
The filled milk.
Come from? Coconut milk, nut milk, cashew nut milk, right? These are all the recipe of a plant, right? So you can have this. One last question.
Myself working as an IT professional in a pharma company, which actually decide the medicine to the doctor. It's a quite interesting topic for me. Thank you for
Thank you.
this presentation. So, but the one question which is always coming in my mind, which has not been covered here, which I know, that what is the cause behind all the diseases? Because, like as you say, like after like person go to the doctor and suddenly they say that you are diabetic or you have this disease, or like at the age of 40 years or 50 years, maybe any age for the patient. So they never tell what is the root cause.
Yeah, cause.
Which is like quite interesting topic for
I'll tell you the cause.
Yeah, so this is, I feel that never any doctor decides what is the root cause for this.
I'll describe it. Partially I told, but I'll tell you again. Number one is truly overdiagnosis. You are not a patient. Everything is okay. Your blood sugar is normal. Yeah. The question is very simple. The question is that why a person become diabetes patient at the very first place? What is the cause of the lifestyle disease? Why it happened to a person? Firstly, it is the overdiagnosis. The patient is healthy, but on glucometer certain number is shown, and if it is more than that number, the desired threshold, he will be labeled as a sick patient, although he is not sick. That's why the guideline is changed again, ACP guideline, right? So 90% of the patient, either blood pressure or blood sugar, in reality they are not a patient. They are made to believe that you are a patient based on certain parameter which is randomly set. That is one thing. Second, there are true patients who are actually sick. They went because they have some discomfort, right? And the reason for this is only one thing I suppose, that nowadays you see your consumption of fruits and vegetable is almost negligible in raw state. Each one of you write what you ate yesterday, morning till evening, and now see what is the percentage of fruits and vegetable intake. I can bet it is less than 10%, or maybe 0% for most of you, right? So this means you are eating the food which can fill your stomach, which can give you energy, but it is not having the curative property. Curative property is different, and that is God has given only to fruits and raw vegetables only. So what you did, you used food as medicine. The way I said, the moment you start eating it, so whatever problem was there in the body, it starts curing it. So I say that if you eat this way, the disease will not come, and if it has already come, if you start eating in this way, the disease will disappear again. Right? So the consumption in modern lifestyle, you see in Singapore, so everything comes out of the fridge, right? Packed, refined, processed, animal protein, right? Biscuit, bread, jam, sauce, right? So in this fast lifestyle, we forward now you see why the concept of juice came, because quickly you can consume it. But you see when you chew it, so brain is giving signal. You are not chewing it, right? So brain, that signal is not going. Still the body is producing same amount of insulin, but delayed production. Delayed production. It's like you went to watching a movie, but you went late. You paid the same amount for the seat but you lost a good part of the movie, right? The same thing happened in the body. Delayed production of insulin, right? So you have to allocate a proper time for eating. That is every day 40 minutes for breakfast, 40 minutes for lunch, 40 minutes for dinner, at least. So do you really give? You spend about 10 minutes to finish the lunch, right? So where is chewing? Chewing is not happening. This means you are eating only those things where chewing is not required, right? This means the body is missing. It is like somebody is coming to your house, you invited somebody, guest for your house, right? So you make some preparation to welcome the guest. That day you are too busy, right? But suddenly that guest sometime without telling you suddenly appear. Then what will happen, right? You will be in a chaos. You want to welcome, but you are not prepared. So body is not prepared that food is arriving, right? Because you don't give the warning or you don't give the signal to the body. You finish your lunch in 10 minutes, right? So the first signal is missed. And the first signal is missed, so now it is all about chaos, right? So with this, I end this talk and I invite Mukhtar. I know the number of questions which you had in the beginning, now the question is much more than what it was in the beginning, right? So more we talk, yeah, it is good sign, but many of the questions answer you will find when you read these books, right? All the best. Thanks for listening. Thank you. Thank you.